Hello everyone, welcome to sqadia.com. I am Dr. Shafaq Jali and today we are going to talk about Guillain-Barré Syndrome. GB syndrome is basically a rapid onset muscle weakness that is caused by the immune system damaging the peripheral nervous system. Initial symptoms are typically changes in sensation or pain along with muscle weakness. It begins in the hands and feet and spreads to the upper body and arms bilaterally. These symptoms develop over hours to a few weeks. If the patient is suffering from the acute phase, this disease can be life-threatening. About 15% of the patients develop weakness of the respiratory muscles for which they require ventilatory support. Some of the patients develop a weakness of the autonomic nervous system, and it can lead to dangerous abnormalities of the blood pressure. We don't know the cause of GB syndrome, but the underlying mechanism suggests that it is basically caused by the immune system attacking its own peripheral nervous system mistakenly, especially the myelin insulation of the peripheral nerves. We can say that this is preceded by an infection in most of the cases, and sometimes it can occur after a surgery, or in rare cases it can be caused by a vaccination. In this presentation, we are going to talk about the types and heterogeneity of GB syndrome. We will see the signs and symptoms, and we will see how we can diagnose it. We have divided this lecture into subsequent sections. In the first section, we will talk about the types and heterogeneity. We will see what is GB syndrome, what are the types and subtypes, and what is its heterogeneity. In the second section, we will specifically talk about the clinical features. We will see the initial signs and symptoms with which patient presents to us, the late signs and symptoms, and what are the signs and symptoms that occur if there is autonomic involvement. In the third section, we will talk about the pathogenesis. We will see what is the immunopathogenesis of GB syndrome, what are the specific antibodies that are associated with each type of GB syndrome, and what is its pathophysiology. In the fourth section, we will talk about the diagnosis. We can diagnose GB syndrome with various ways, either by examining the cerebrospinal fluid and other lab findings, which includes nerve conduction studies. We will see what are the diagnostic guidelines and what is the differential diagnosis of GB syndrome. And in the final section, we will talk about the treatment of GB syndrome. There are several methods for the treatment. The first is we use high-dose IV immunoglobulins, or we can use plasmapheresis and glucocorticoids in different patients. And finally, we will see what is the prognosis and recovery in each type of GB syndrome. So this is today's lecture. I hope you are excited to learn about this syndrome. Stay with us and keep watching sqadia.com.